been a very, very long year, I realize, for a lot of us, but we've got to hang in there. And I think it's very important that we look at our youth and teach our youth to be safe and to be wary of how dangerous this disease really is.
I was privileged to get the first Moderna vaccine at our band level. We need to flatten this curve real bad because it's affecting so many of our families. We have lost so many family members to date. It's important for everyone, especially the elders, to stay at home and stay safe.
As First Nations people, we follow the 4 directions. We use the circle of life in many ways. For example, the east, the motion, the sun. The south, the spiritual, the grandmother. The west, the mental, the thunderbeam. The north, the physical, the buffalo, the wind. If we honor these teachings in ceremony and for our own well-being, we can overcome this COVID-19 with strength, courage, and hope.
Keep smudging, keep praying, and keep sanitizing. This is the only way we're going to defeat this.
And we need to stay our distance. We need to use our face masks. We have all of that and to go forth with, and also get our COVID shots that are made available within our communities.
Good morning, everyone. My name is Cedric Rayleau, and I will be your chair for this final day of the AFN's COVID-19 virtual forum, sharing lessons learned and supporting a new path forward. I want to take the time to acknowledge that we are streaming from the unceded territory of the Algonquin Nation, based in Ottawa. And to open us up in a good way, I'd like to turn the microphone to our knowledge keeper, Gwen Point.
To everyone online, Shaishko to Homo to Squee, Alcamel to Homo to Stalo, to Iatalato, our relatives, Musqueam, Tsleil-Waututh, and Squamish. And my traditional name is Shaishkowit. The language I speak is Halkomelem, and I'm Stolo. I'm here in the unceded territory of the Musqueam, Tsleil-Waututh, and Squamish. I really appreciate the video. Thank you so much. It is really heartwarming to see our dear elders and sharing the teaching and being able, it's a real comfort. I know that's how I felt growing up. If my grandmother walked in the room, my aunt or my uncle, a level of comfort came with that feeling. And we sure need that right now. We do. And I want to thank AFN for all the good work being done here to support the messaging to our families and our communities. We need this. We're told that the words are for your mind, and the prayer are for your spirit. And of course, the food nourishes our bodies. So it's all of that. It takes all of that to help us walk through this challenging time with COVID-19. And I'm so grateful as well for the good work for today. So we say Ti'ia Dalatul, Tetel Atias. So I'm asking special blessing, Creator of all good things. I give you thanks for this day, and I give you thanks for each one joining. Creator Ti'ia Dalatul, Diskakla. Thank you for the words that would be shared today. Creator, special blessing on each one. Tetel Atias. Give you thanks for their very good work. And work for us, it's not a verb, it's a noun. Ti'ia Dalatul. When we give thanks and when we connect with the Creator, we're blessing the work at hand. To keep our dear people safe. Keep our families and our communities safe. To let the people hear the good words. Let them begin to follow the words that were shared by the elders. Creator of all good things, special blessing on our leadership. The AFN represents our First Peoples in Canada. Keep our leaders safe, Creator, that they can continue to do the good work. Creator, I give you thanks for all leaders, that they can hear one another, walk together in a good way. To Iatalatal, give you thanks for the AFN staff. Thank you, Cedric. To Iatalatal, Tetzel Adias. Thank you for your good work, Cedric. Thank you to once again, for all the staff that bring us together with a good mind and a good heart, a one mind and a one heart, and a strong mind and a strong heart. Yes,
Well, the Knowledge Keeper. And of course, Walalio to the Knowledge Keepers Council for their video. We saved the best for last, and I really do believe that. So thank you for your sharing, Gwen, and I bid you a great day. So welcome to day 3, our final day of this COVID-19 virtual forum, sharing lessons learned and supporting a new path forward. On day 1, we talked about community-led responses. We talked about the strength of partnerships and data and its importance in our response. On day 2, we talked about how to support different populations which were vulnerable or most impacted by that pandemic. And today we're here to talk about how do we build back better? What are the next steps and how do we go forward from a First Nations perspective and inclusive of our First Nations peoples? We had a bit of technical difficulties on Tuesday. I'm pretty sure some of you are aware. So we had to play with the schedule a bit, but we'll be getting to all of our presentations for sure. The major change will be that National Chief's remarks will be moved to this afternoon at 2:45 p.m. Eastern Time. We are also lucky to have Dr. Sarah Funnell, who sent a video for her presentation that was supposed to be on day 2. We moved it to just after opening remarks. So you guys will still get to hear from Dr. Funnell on the frequently asked questions and some of those things that we need little specifications about. I also want to take the time to remind you that these are difficult conversations in certain instances and that they may elicit some emotional response. So if ever you want to talk to a counselor, we do have the Hope for Wellness line that is available for everyone. It is at 1-855-242-3310. Or else you can connect online at hopeforwellness.ca for an online chat. The resources are there for you if ever you need them. Today, we will be going through our presentation by Dr. Funnell. We will then have 4 presentations on data governance, mental wellness, emergency management transformation, as well as the economic recovery. And that will go into a break, and after that, into the workshops with our 4 presenters. Again, if you have any questions, that will be the time to go speak with the people directly and really try to look, how can we build forward and have those conversations, make sure that we understand how to be inclusive of First Nations people and also how we can move and build better, build back better. If ever you're having trouble on your devices, hopefully on our side, everything's good this time. But if you do need technical assistance, 1-833-236-8324. And this is available until the end of the forum. So again, 1-833-236-8324. And a final reminder, we will be having all of our PowerPoint presentations as well as recordings on the AFN website. You can go to the COVID-19 virtual forum page and everything should be available there in the next coming days. So now, without further ado, as mentioned earlier, our next presentation will be by Dr. Sarah Minwanamid Funnell. Moved from the agenda on Tuesday to today. She's a First Nations family physician, a public health specialist, an associate medical officer of health at Ottawa Public Health, and director of Indigenous Health within the Department of Family Medicine at Queen's University. Since March 2020, When all of this started, Sarah has directed her attention towards supporting the COVID-19 response and advancing Indigenous health medical education. Can we have Dr. Funnel's video?
Hello. My name is Sarah Minwanamad Funnel. I'm a First Nations family physician and public health specialist. I was invited by your organizers to discuss COVID-19's learning journey for the AFN COVID-19 virtual forum. I want to start by acknowledging that I'm meeting you here today on my traditional Algonquin territory of Ottawa. I also want to acknowledge all the lives that have been lost as a result of COVID-19 and all the hardships our people have experienced as a result of COVID-19 and other systemic issues within our country, which we call Turtle Island. Next slide. The outline for today's talk is I'm going to do a quick overview of COVID-19, talk a little bit about the Delta variant, our current resurgence that we're experiencing right now, a little bit about COVID-19 in children, vaccines and breakthrough cases, and I'll recommend some possible future actions for us to consider. Next slide. My father, Simon Brakupe, Algonquin Haudenosaunee elder, told me to respect the virus. He said, "It is said, do not fear the virus, respect it. Respect is one of the cornerstones of our values. When we respect something, we lose fear of it, and attitude and behavior changes. Like learning to swim, you must respect both the beauty and the danger of water." Same with the virus, we need to pay attention to the precautions and safety practices we know that will keep us healthy, because fearing the virus may result in behavior that's dangerous. And so as a public health physician who has been guiding Ottawa Public Health in our local response to the pandemic, it's been difficult for me at many times to respect the virus, but it's important to remember to do so. I also, next slide. I've thought about COVID in this way, as a trickster. So we know that trickster tales are stories, but they also have important lessons. And so I read an article by Ed Young, How the Pandemic Defeated America. And this is what he said. So COVID-19 is just bad enough in every way. Severe enough to kill millions, mild enough to move undetected through a population, spreads quickly to overload hospitals, but slowly enough that statistics don't spike until too late. And so we know that COVID-19 is spread through our respiratory droplets when we laugh, sing, talk, cough, yell, and many people think of their COVID-19 symptoms as very mild. Some people do not even have any symptoms, yet they're able to spread COVID. And we've seen some disastrous situations, very sad, traumatic situations where people have died, and the person that unknowingly carried COVID into a situation didn't know that they were sick with COVID. COVID loves to spread in crowded places, crowded workplaces, crowded homes, and places with poor ventilation. We know our First Nations people, many of us live in crowded homes with poor ventilation and lack of clean water. And these are some things I'd like you to consider as we explore our learning journey about COVID. Next slide. Just quickly, I wanted to talk about an adaptive response to COVID. We've all experienced this. The virus comes in waves, as they're called, in surges over time. And there's several areas of intervention that we can contribute to help curb that transmission of the virus through our population and our communities. Firstly, there's disease control. So that's a lot of the work that I do at Ottawa Public Health. We receive tests, results of those that have tested positive. We do contact tracing. Our teams also prevent and work with long-term care facilities, for example, to ensure that their infection prevention and control practices are sufficient, and manage outbreaks. So that's sort of the disease control. That's the test, trace, isolate framework. The non-pharmaceutical interventions are what we relied on extensively before the vaccine came into play. So those are staying at home, isolating, washing your hands, closing businesses and schools. Those are all those restrictions or lockdowns or shutdowns that we know that have helped curb the transmission of COVID, yet have their unintended negative consequences, particularly on mental health. And so part of the adaptive response is also supporting society. And so at Ottawa Public Health, for example, we have collaborated with our Indigenous practitioners within the urban area of Ottawa to help support the urban Indigenous communities cope and manage with COVID, both with testing and vaccination programs. This is just a small part of the framework in the visual representation. However, I think it's one of the most important parts of the adaptive response to COVID. And finally, pharmaceutical interventions. Treatments, we don't have a lot of treatments. For those that are very sick, it's a hospital admission with oxygen supplementation or intubation in the ICU. And now we have the vaccine. And so as we go through the pandemic over time, how intensely we apply all of these parts of the adaptive response changes. So we know that at a certain point in time, when we have so many cases, it almost becomes impossible to do the full contact tracing. And that's when we really rely on the non-pharmaceutical interventions to help us. And so just to note that over time, it's expected that some of our actions to curb transmission will change depending on how many cases we have of COVID-19 and how many outbreaks. Next slide. I was asked by your organizers to talk about the fall resurgence. Some people call it the fourth wave. I'll show you in a second that in Ottawa, we've actually experienced, we're in our sixth wave. So we like to refer to it as a resurgence. And so in the early spring of 2020, we had our first surge of COVID cases. Last fall, we had a second surge. Through the winter and spring of 2021, a really incredible surge in cases across the country. And now we are into that fall resurgence, and it remains to be seen how each geographical area, province, community will cope with that. Next slide. In Ottawa, we have a dashboard that keeps track for the public to see how many cases we've had and how well we're doing. And as an Ottawa Public Health physician, I wanted to share this with you to show you that each community experiences COVID slightly differently. And so for us in Ottawa, we're in our sixth resurgence. So we had that early spring one of 2020. We had a small resurgence in late July, early August, and we think that was a result of Canada Day celebrations. Then we had the fall wave of last year. We had an early winter wave as a result of socializing pre-Christmas and holidays. We had a spike in cases. And then again, as most of the country experienced, a very large resurgence of COVID last spring. And now we are starting our fall resurgence. I was also asked to talk a little bit about the vaccine. And I'm here to let you know that the vaccines that we have for COVID-19 are effective and safe. And so you can see here that the percentage of those individuals who are hospitalized that aren't vaccinated represent, this is across the country, this is a national level data, is 84%. of those that unfortunately pass away as a result of COVID, they represent 81% of deaths. So you can see that vaccination really decreases your chance of hospitalization and death, also decreases your risk of getting sick from COVID. And so you can see that those that are fully vaccinated in the far right column are much less likely to become sick with COVID, much less likely to be hospitalized, and much less likely to die. And so from that, we can say that vaccination is an important component of managing this fall resurgence and going into the winter. So I highly encourage those that have not been vaccinated to get vaccinated, those that have been partially vaccinated to become fully vaccinated, provided they do not have any contraindications. So speak to someone you respect, an elder, a physician, a public health service provider to talk about getting vaccinated. So that's the national level data. We see similar data in the Ottawa area. At this time, the risk of COVID infection among unvaccinated, and there's asterisks, is vaccinated eligible populations, because we know children under 12 are not yet eligible for the vaccine, but soon will be. So those that are eligible, so anyone 12 and up that's eligible for the vaccine yet have not been vaccinated, is 11 times higher. They have 11 times higher risk of getting sick than those that are fully vaccinated. So just to consider that. We know there's lots of reasons why people aren't vaccinated or partially vaccinated. It's more than just those that refuse vaccines. There are equity issues in accessing the vaccine, and we all have a role to play in ensuring those that want to be vaccinated or are questioning vaccine have the right information and options to get vaccinated. So I wanted to leave us with some additional thoughts. This is a framework we use in public health. It's called the Health Impact Pyramid. And so you can see that for any number of health issues that you'll have increasing impact at a population level with less effort by individuals, requiring less resources if we address socioeconomic factors. And in the Indigenous context, I often add even below that, we will have even more impact if we address racism. So racism, I think, is even a more powerful determinant of health that then flows socioeconomic factors. So I'm going to start at the top of the pyramid and say, so counseling and education, which is a lot of the attention we put forward in terms of preventing people from getting sick from COVID, and including counseling and education about vaccines. We know that that requires a lot of effort. So, and the impact on the population may not be as great as addressing socioeconomic factors. The next level of the health impact pyramid is clinical interventions. And in that clinical sense, that may look like ICU admission or hospital admission. I also think of it as the public health interventions that are needed to curb the transmission of COVID. So all those public health nurses that call individuals to say, you've tested positive for COVID, please stay home, you must stay home, who have you been in contact with? That requires a lot of resources, human health resources, and financial resources. And the impact may not be as great as addressing racism and socioeconomic factors. Next in the pyramid is long-lasting protective interventions. So this is where the vaccine comes into play. The vaccine has lasting protective interventions. Of course, we're learning much more about the COVID-19 vaccine to know exactly what the right vaccine series will be going forward. And this is preventive. So the vaccine prevents you from getting sick, and that is prevention is always worth the effort. Because once we're in reactive mode, it requires a lot of energy and a lot of resources. So I cannot understate the importance of COVID vaccinations in this context. It's the most specific thing you can do to protect yourself from COVID-19. The next layer is changing the context to make individuals' default decisions healthy. So we want to make the healthy decision the easiest decision people can make. And so, for example, if it's getting vaccinated, then having the vaccine available when an individual comes to speak to a clinician, and in that moment they decide they want to be vaccinated for COVID-19 and the vaccine is there and they can receive the vaccine, helps change that decision to be an easy decision. Whereas if they come to see you as a practitioner, you talk about it, they're like, yes, I want to be vaccinated. Okay, now you have to book your vaccine and you'll get it in a week. Lots of things change for people in a week. And so in terms of making that decision to be the easiest decision, a lot of things have to be put into play. And so but you can see that it's worth the effort because at a population level, it has a bigger impact. And so finally, yet not finally, because we know racism has an even larger impact on health. Socioeconomic factors. So these are where I categorize housing, appropriate living conditions with good ventilation, access to clean water, not being crowded, workplaces, access to an acceptable income and education. This is where we can have a really big impact, not only in curbing the transmission of COVID, but also any future pandemic that comes. And so I know that this area, addressing socioeconomic factors, takes more than just us on this call, right? It requires political will. It requires our society to see that's important. And so I'm a firm believer in adequate, affordable housing and ending poverty. Both of those things will have an incredible impact both on addressing COVID, mental health, and other infectious diseases. I know I was meant to speak to you live and we're going to have an opportunity to ask questions. I'm willing to answer your questions by email, so don't hesitate to reach out to me. And just a final quote and a miigwech. While we cannot change the past, understanding how it continues to shape the present gives us an opportunity to collectively move forward to a better future. And I know all of you have that on your mind during this COVID AFN virtual forum. And miigwech.
Thank you, Dr. Funnell, for those words. And as mentioned by Dr. Funnell, for those of you who would like to ask her a question, same process. So the top right-hand side of your screen, you have a little waving hand icon. You can send your questions by there and our staff will make sure to pass them on to her. Or else you can also send your questions at covidforum@afn.ca. And all those questions will be sent off to Dr. Funnell. As we did with our last presenters, I just want to take the time to say that we will be sending a donation in Dr. Funnell's names to the Orange Shirt Society in honor of the inaugural year of the September 30th being the National Day for Truth and Reconciliation. And now we get on to our first panelist. This panel is on the theme of building back better, what it means for First Nations, and what is needed for the path forward. Our first speaker is Dr. Jonathan Dewar, Chief Executive Officer at the First Nations Information Governance Center. He is the CEO of the First Nations, has spent most of his 20-plus year career directing research and knowledge translation initiatives on behalf of Indigenous government national NGOs, but has also been recognized as a leader in healing and reconciliation, as well as Indigenous health and well-being education, policy, and research. So to talk to us about the role of data governance, Dr. Jonathan Dewar.
Miigwech, thank you for the introduction, and it's a pleasure to join you. In the interest of time, I'm going to give a very quick overview of the First Nations Information Governance Center for those of you who are maybe a little bit less familiar with our work. And then I'll quickly get into some COVID-specific information, and then into the Build Back Better focus, which is the First Nations Data Governance Strategy, which you can see is the title of the presentation that I'm giving today. So next slide, please. So for those of you who are familiar with the First Nations Information Governance Center, it's usually because of our national survey work, most notably the Regional Health Survey, which is 20 years of work by First Nations thought leaders, and of course supported by First Nations leadership at the national level and across all of the regions. That work began in the mid to late 1990s. And alongside it was the development of the Ocap Principles. So that's the second thing, that if people know us, it's often because of those Ocap Principles. As a national organization, we are the stewards of the Ocap Principles, which means we help educate people about the Ocap Principles, and of course, also do specific training around the Ocap Principles. We have been a standalone First Nations organization for 11 years, stood up with a mandate from the National Assembly of First Nations Chiefs in Assembly. And we are guided by principles, research ethics, and a cultural framework developed by First Nations for First Nations. And it's really important to understand that governance is in the title of our organization. And so that goes to the governance of this organization as well. And so we are accountable to nations themselves through the governance of our organization. And in this sense, nations choose to come together within regions through appropriate regional processes, and then those regions choose to come together to do work that is best done or necessarily done at a national level. And I've talked about some of that work just now. It's important to know that we are independent and that we are strictly technical and strictly apolitical. So we work closely with the Assembly of First Nations and regional partners across the country, but we do that work from a technical perspective. We're not a rights-holding organization, and we don't purport to represent First Nations interests directly. We have an appropriate lane that we operate within, and it's very much data-focused and the specific initiatives that I'll cover next. So next slide, please. We have a vision and a mission. You'll see our vision is very much focused on First Nations data sovereignty, and specifically the idea that every nation will achieve data sovereignty in alignment with its distinct worldview. So when I talk about nations choosing to come together, we don't lose the fact that nations come with their own worldviews, histories and languages and approaches to all of these issues. And we come together and we make collective decisions together for the benefit of work at a national level. The mission follows the vision. It's on your screen, so I won't linger there. Next slide, please. And then core strategic objectives follow the vision and the mission. And you can see again, the focus on community-driven and nation-based. And the importance in that last bullet there, the importance of relationship. So it is all about partnerships, connecting regions to strengthen data sovereignty. Next slide, please. And then the elevator pitch for what we do is national surveys, research that aligns with the priorities that have come out of what we've learned from 20 plus years of national surveys and related work. And then, as I said, education, training, and capacity work. And that last bullet in that column, you'll see we focus on the First Nations data governance strategy, which is the component that I'll end with. Next slide, please. The First Nations Principles of Ocap, I said, it's one of those two things that we're most well known for. If you're not familiar with the First Nations Principles of Ocap, that acronym stands for ownership, control, access, and possession. This is a set of principles, really a tool to be wielded by rights and title holding First Nations. And so the important distinction here is between principle and implementation. FNIGC, we work at the level of principle, certainly in the education and training work that we do, but it is rights and title holding First Nations that choose how to define and implement ownership, control, access, and possession. So it is their right to do that. Next slide, please. So information governance or data governance and COVID-19. This pandemic has forced us to confront many things, and fortunately, work that has been done by First Nations over many years has put us in a decent place to address this particular pandemic, though we've also learned that there is much yet we need to do. So throughout this pandemic, we've seen that the completeness, availability, and timeliness of national and regional COVID-19 data on First Nations, regardless of where First Nations people live, is an ongoing concern. These issues have collectively impacted the ability of First Nations to respond to the pandemic and plan for the safety of nations and communities in a timely manner. And it's highlighted the importance of First Nations data governance, digital infrastructure, and good information. Next slide. First Nations governance over data ensures that First Nations have access to their own information, thereby providing opportunity for First Nations to ask relevant questions and ultimately make informed, evidence-based decisions, which can be used to build appropriate interventions. Ultimately, the governance over First Nations COVID-19 data and other relevant data provides for First Nations control in combating outbreaks in their own communities. Essentially, it puts First Nations in control of the outcome. Next slide, please. So this is the part that I'm going to end with, a reference here to the First Nations data governance strategy. So the implementation of the strategy, honoring First Nations inherent treaty rights and supporting data sovereignty, is an enabler for First Nations to access the data they need, thereby strengthening their positioning in response to the current pandemic and against all other future emergencies. The development of governance mechanisms that support federal, provincial, territorial, and First Nations relationships brings opportunity to change the systems that perpetuate inequity faced by First Nations. First Nations capacity must be increased to ensure that First Nations have an equal voice at these tables. Next slide, please. The development of capacities, which are inclusive of technological, infrastructure, and human resources, presents opportunity for First Nations to manage and utilize data to meet their needs, thereby enabling self-determination and mitigating dependency on the FBT systems. Building First Nations data governance capacity, locally, regionally, and nationally, is a necessary element for the success of this work. Next slide, please. It's very important to note that some of our regional partners have been successful in brokering data-centric relationships with their provincial or federal counterparts or external provincial third-party data stewards. However, there is still tremendous amount of work as well as sustainable and predictable investments that are needed to support these regions in their effort to bridge gaps, not to mention the relationships, infrastructure, and capacity that is needed by the remaining regions that have yet to access their data. Next slide, please. So I've talked about the First Nations data governance strategy and how it is one of the drivers for building better toward the future. I don't want this to sound like it's a new initiative in response to COVID, although the timing is really quite interesting. It is important to know that this idea of First Nations data sovereignty, or ideas around First Nations data sovereignty, are decades old. So our First Nations leadership, particularly the thought leadership, helping to advise our formal leadership, has been working on these concepts and ideas for decades, and it has seen itself formalized in ways. Now, one of those ways, and one of the more recent ways we've seen that formalized, is in this AFN resolution from 2016 titled Funding for Regional Information Governance Centers. And you can see the Chiefs in Assembly called for 4 things there. They wanted to see engagement on data governance. They wanted to see data governance champions in each region. They wanted to see regional First Nations information governance centers. And then finally, they wanted to see a national strategy. That led to Federal Budget 2018 and this item, an investment of $2.5 million to FNIGC over 3 years to develop a national data governance strategy and then coordinate the establishment of regional information governance centers. So you can see there that the federal government responded to the National Chiefs in Assembly, responded to 2 of the things that the National Chiefs in Assembly called for: the design of a strategy and ongoing work toward regional information governance centers, or RIGCs as we sometimes refer to them. That's not a surprise that the federal government would say, let us see your strategy before we look at investing further. I'm very happy to report that we did that work over 2 years instead of 3, and in fact delivered the First Nations data governance strategy in March of 2020, so some 18 months ago. Next slide, please. From 2018 to the delivery in 2020 of the data governance strategy, we held many engagements within regions through our regional partners and at the national level as well. And you can see there, makes note of a national summit we held in February of 2019, and one of the many graphics that came out of that work. Next slide, please. So what did the strategy look like that we delivered? Well, it was a strategic framework, and it had a number of principles, and they were grouped under 8 thematic areas, and that's that red flower-like image you see in front of you there. So those 8 themes, underneath each of those themes are one or more distinct principles that we will uphold as we advance this work over the coming years. And then, of course, there are what we refer to as the 9 pillars. And I'll just note that those 2 pillars at the top there are horizontal or cross-cutting, and they are essential foundational pillars to be established, and then they cut across and sustain the other 7 pillars as we build or continue to build capacity in those areas. Next slide, please. When we delivered the strategy, we called for 2 things. One was bridge funding so that we could continue work. And then the other was specifically for the government to focus on that call from 2016 by the National Chiefs in Assembly for the establishment of data champion teams. I'm going to say a bit more about that in a moment. Next slide, please. Next slide, please. There we go. So that led to April of 2021 and federal budget 2021. There was a budget item called Support for Indigenous-Led Data Strategies. And you can see here, it says very specifically, Budget 2021 proposes to invest $73.5 million over 3 years, starting in 2021-22, to continue work towards the development and implementation of a First Nations data governance strategy. This is the most significant investment we've ever seen in institution building for First Nations for the purpose of information governance and the statistical work that we need to do to best serve First Nation citizens across the country at a variety of levels. Next slide, please. So what's the strategy about? The next several slides have more information than I can cover in about 4 minutes. So I'll just give highlights, but I do want to remind people that all of this information can be found in detail on our website, which is fnigc.ca. So the strategy is about creating a path for First Nations to realize data sovereignty, which is the cornerstone of nation rebuilding. The key principle here is community-driven and nation-based. So you've heard me talk about the regions. We're working with the current structure, but our focus is very much on nations, right? So the idea that nations have their own distinct worldview. And then communities are the places that people live. So we need decisions from the ground, from the grassroots, driving up from a community level within the nation context, and where nations choose to come together for strategic regions. There are a variety of reasons why we do that. Economies of scale, the size of our populations, there are benefits to this. What we need is increasing levels of data literacy so that our citizens and, of course, our leadership understands and can make informed evidence-based decisions. So really, this strategy is about a continuation of what we're currently doing under the auspices of FNIGC. It's about nations in each region choosing to come together to create a fully functional institution of their own within that region, or a regional information governance center. These regional information governance centers will continue to do work at a national level. It's a continuation of the existing network. Right now, we have a network of somewhat disparate organizations working to serve the interests of nations in regions, and it is really quite functional. But this strategy is to take it to the next level, to create the best foundational infrastructure upon which we can build. Next slide, please. So how will it work? Well, in order to build institutions, you need dedicated capacity to build institutions. This is not something First Nations or our regional partners have ever had. So that budget 2021 investment, that is the investment in dedicated core capacity for, as I say, this institution building work that we need to do. So we have used the language that the national leadership used in that 2016 resolution, calling these this dedicated capacity data champions, or in this case, we acknowledge that they're really teams of capacity that need to be established. And so we expect, now that we have made it through the election, now that we know we are looking at another Liberal minority government, we expect that the priorities will not have changed, that the bureaucrats over at Indigenous Services Canada will return to the work of advancing that priority and creating the pathway for FNIDC and its regional partners to draw down on the funds from federal budget 2021 to begin the implementation of phase 1 of the data governance strategy, which, as I said, the first step of which is the establishment of these data champion teams or dedicated institution building capacity. So what does that mean for timelines? Well, we don't expect to be able to access those funds until well into perhaps 2022. So we may have to phase shift the timing. We're in negotiations with the federal government now on that to ensure that our regional partners and the nations within have the robustness of that 3-year plan that we communicated in our data governance strategy. Next slide, please. So, how will it work? Well, eventually, these data champion teams will build up these institutions. And these institutions will have 2 main focuses. They will serve the unique information needs of the nations in the region at a variety of levels. And they will continue to come together as a national network. And that national network will be the de facto national institution, for lack of a better term, and will continue to do the work that is best done collectively and collaboratively at a national level. Next slide, please. When will all this happen? Well, institution building takes time. That's why our data governance strategy was very deliberately mapped out in phases. We've asked for phase 1 funding. We have received phase 1 funding. It's foundational building. We will move through phase 1 and on to phase 2. 2025, 2026 is the likely timeline for phase 2. And next slide. This is just a slide of the key progress to date. Next slide. And that is it. I'm done. Thank you, Miigwech. I look forward to joining some of you in a workshop later if you have deeper or more probing questions, understanding, of course, that I gave this presentation quite quickly. Thank you.
Thank you, Dr. Dewar. For our next presentation, we have 2 speakers here to talk about mental wellness and culture as a foundation. Our first speaker is Dr. Carol Hopkins, Executive Director of the Thunderbird Partnership Foundation from the Lenape Nation at Moraviantown, Ontario. Carol has spent more than 20 years in the field of First Nations addictions and mental health and holds a master's degree of social work from the University of Toronto, as well as a degree in sacred Indigenous knowledge. Presenting with Dr. Hopkins is Dr. Brenda Restool from the Dokas First Nation and from the Eagle Clan. She's a registered clinical psychologist and the Chief Executive Officer of the First Peoples Wellness Circle, which is an Indigenous-led national organization dedicated to raising the profile of Indigenous mental wellness using Indigenous knowledge and evidence. So to talk about mental wellness and culture as a foundation, Dr. Carol Hopkins and Dr. Brenda Restool.
When Bojon in the way Markin Adobe, no Gem Indigenous cause Gaye, my Ingan and Dodem, Lanila Nape, Quay and Dow, Lenape King in Donjaba. I'm the CEO of Thunderbird Partnership Foundation. Next slide, please. And Brenda and I had many topics that we wanted to talk to you about in terms of mental wellness for First Nations and the impact of the pandemic. But we settled on 2, and I'm going to be talking to you about substance use, and Brenda will talk more about worker wellness. Next slide, please. Next slide. So in our conversations with Northern Ontario, not just Ontario, Northern communities across Canada, and also through our data collection with the First Nations opioid and methamphetamine survey, we have gained insight around the pandemics and around the pandemic and substance use. So we know that also through the work of treatment centers, the National Native Alcohol and Drug Abuse Treatment Centers and the National Youth Solvent Abuse Treatment Centers, about half of them, about roughly 47% of those treatment centers quickly converted their programs to offer them in a virtual environment, primarily focused on psychoeducational support. They register the clients that access those virtual treatment services. And from that, we know that in some cases, the use of substances declined, but for those who were using substances, the frequency of their use significantly increased. So 4 to 6% higher in severity. That means they've used substances 20 or more times per month during the pandemic compared to the data we have of substance use pre-pandemic. And this comes from the National Addictions Information Management System that the treatment centers use. And so the combination, polysubstance use, alcohol, tobacco, stimulants, including the methamphetamines, opioids, sedatives, and hallucinogens are common in polysubstance use. The combination of those substance use together at different periods of time create significant risks for individuals. We also know that in First Nations communities that saw a decline in substance use during the pandemic, saw a decline in the harms related to substance use, were communities with unique features. And some of those features are that the communities already had an established relationship with clinicians, so physicians or nurse practitioners that were engaged in long-term relationships with the communities, who offered support and collaboration around community decision-making, around policy, engaging elders and cultural practitioners for land-based programming, supported their requests for additional funding, and also paid attention to the importance of land-based activities. And there were communities that also supported virtual support services through telephone, through chat, and virtual counseling services. And in some regions, there was an increase in accessing cultural supports versus clinical supports for counseling. There was also, in these communities, cooperation, cohesion amongst community members in supporting the lockdowns and the border closures. When communities began to close their borders, there was fear that substance use would increase and the harms related to that substance would also increase. But in fact, in these communities, and I have to say that the key factor in all of this is relationships, partnerships, and collaboration. Where those elements were present and the support was provided to the community, they saw less harms related to substance use. Next slide, please. And so as a result of that, what was recommended and described as a hub and spoke model. Oftentimes the hub is in urban environments. That does not serve rural and remote communities very well. And so we have to change the way we think about the hub. The hub is the First Nation community with First Nations governments, working with cultural practitioners and elders, going out on the land, and within the context of community resources. And so around the hub are the additional services from within the community and external to the community that support that community environment. So the clinical care that is often embedded within local health authorities with the support of public health units, often provincially funded, where there's support to families of people, families connected to people who use drugs. So if a mom has a concern about the substance use of their adult child or younger child, we know from our opioid methamphetamine survey that youth as young as 12 years old are introduced to using methamphetamine. Youth are using drugs by needle injection because that's common in the environment around them. These are significant issues that we need to change. And what's going to support that change? Culture, access to land, support of elders and cultural practitioners, as well as rapid access to addictions medicine. There are, 24-hour crisis lines and ability to chat, physicians and nurse practitioners willing to have conversations with community government to support decision-making, policy, and program support. Also, the need to refer out to other resources, building community capacity through training and mentorship. A number of key things to supporting First Nations in reducing the harms related to drug use. Next slide, please. So there are a number of recommendations related to harm reduction, building that capacity in community, ensuring rapid access to addictions medicine, partnering and ensuring culturally appropriate and relevant service providers through land-based programming, elders, cultural practitioners, ensuring that these are community-based solutions and further investments, increased investments. One of the things that we heard through the pandemic is that community efforts that are already have many of the things on this list were significantly impacted by the inability to retain qualified workforce. And that inability to retain that workforce is largely impacted by the lack of capacity to pay adequate wages. So wage impacts a community's ability to retain a workforce to address substance use. And I'll turn it over to my colleague, Dr. Brenda Ristool. Thank you. Next slide.
Ani Bojo, Obsquestijnakas, Magisi Dodem, Dokistinjba, Anishinaabe Endau, the Bendigosa King. So thank you, Carol. As Carol mentioned, there are a number of things that we could have spoken about. And the area that I'll talk about today is workforce wellness. Next slide, please. We heard from a number of workforces about the issues that they've experienced during the pandemic. We heard from treatment center workforces, mental wellness team workforces, crisis support teams, and the workforce from the Indian Residential School, the Resolution Health Supports and Cultural Support Workers. We also based our information on some literature that we had reviewed in regards to post-traumatic stress disorders and how that might be impacted in our workforce and our communities. And this was looked at to determine how does our workforce attend to the challenges they have. And considering the pandemic has really increased the likelihood of reactions or interfaces with traumatic events, workforce being asked to respond to people's trauma, whether that be the trauma that comes from the pandemic or triggers from trauma, or some of the issues that have arisen, such as the discovery of mass graves at Indian residential schools. We know that our community workers have been asked to respond more to trauma during this pandemic. And so based on this information, what we heard was a number of things. The first thing that we heard about was that there are a number of factors at play that influence workforce wellness. You'll see here that there's a large number of them, and really they span from considering worker, organizational, and community factors that have an impact on the workforce. Some of these things that influence them includes, from a worker perspective, is whether the worker has the skills and the expertise and the knowledge to be able to respond to the needs of the community, whether that be around trauma, cultural requests or needs, as well as simple responses to coping during the pandemic. We also know that the workforce has often described to us that they find themselves in multiple roles with multiple responsibilities. So the workforce recognizes that they often come from communities, and so sometimes they find themselves responding to issues in the community, not only as a worker in a particular workforce, but perhaps as a community member, a family member, a neighbor, a friend. And so that having those types of multiple roles really can be challenging for them. We also noted that they have multiple types of responsibilities. And so not only in their roles, but they might have responsibilities that are also community-based. So in some cases, we have workers who hold roles of leadership in the community. They may also hold volunteer roles in the community, such as perhaps being a firefighter, being a translator. And all of those things really have an impact on their wellness, because they are required to juggle multiple roles with multiple expectations. And those expectations tend to feel like they can be quite high and cause a lot of pressure for them. Their ability to have access to resources, and this is connected to the geographical context. So whether they're urban or more isolated and remote, their ability to have access to resources to best meet the needs of their community and the folks that they're servicing can be a challenge sometimes. So we think about virtual services as one of them. In some cases, the access to virtual services are challenged by their access to the internet and to connectivity and technology, either by themselves as a worker, but also by their clientele. And so the access to resources can also impact their wellness and lead to things like burnout, fatigue, compassion fatigue, and vicarious traumas. The experiences that they bring in their work also can impact them. So they come with their own personal stories, and they also come with the experiences of the community to attend to. So those experiences in the community might be whether the community themselves have a number of resources, if they have good governance models, if they have good, what we would call cultural continuity indicators, like access to cultural practices, governing their own health, education, and social services. Those sorts of things will also impact their ability to attend to their own wellness. We also know that the workforce attends to the colonial structures and processes that are required, whether that be around funding, expectations by professional associations, as well as the colonial, perhaps, policies and procedures that might occur within an organization. The ability for the workforce to have access to cultural knowledge and practices also influences their wellness, as does things like the organizational and human resource capacity. So what is the capacity within the organization to support workers who may be experiencing burnout and fatigue and vicarious trauma, as well as what amount of people are available to attend to the needs of the community or the clientele. So is there one person required to meet the needs, or do they come with a team where there's an ability for debriefing and internal types of supports? The workers' own personal coping and past and current healing processes also impact their ability to attend to their wellness. Access to land and other healing practices also connect to that, because both of those give an opportunity for workers to be on the land and to take care of their personal well-being. Their either personal, community, or client-based experiences around racism and discrimination. The workforce often has talked about when they interface with external partners, whether that be funding partners, service-based providers, or others, they may experience racism and discrimination either in the services, in the policies, or in the one-on-one interactions, which impacts their worker wellness as well. Next slide, please. We also know that there are a number of factors that impact it, and some of these I've already spoken to. Things like whether the workforce is can be recognized and should be recognized as demonstrating expertise in a number of areas. It means that we need to attend to their wellness. They've been recognized as experts in the area of trauma and healing, particularly during the discovery in Kamloops. We know that it wasn't just Indigenous people that were reaching out, but also Canadians were reaching out to attend to their trauma and the issues that they experienced by learning about the discovery in Kamloops. They're also experts in things like complex grief and intergenerational learning and traumas and land-based healing. Some of these I've noted already, so I'm just going to pass on to the next slide, please. We also know, is that one of the workforce areas that needs to be thought about is elders and cultural practitioners. Not all elders and cultural practitioners are paid workforce, and we need to be paying attention to the unpaid workforce, whether they be elders, cultural practitioners, volunteers, translators, and those and other systems that are impacted by what we're hearing from the pandemic. The ability to support them is something that needs to be attended to as well. Next slide, please. And finally, what are some of the investments we need to make? Well, we need to be able to invest in organizational processes and structures from an Indigenous worldview that ensures that we're taking care of the entire community. We need to be able to look at how to create collaborative partnerships and processes within First Nations communities so that we're doing work up front to support clients in a good way. But by doing that work, we're also helping our workforce to reduce the load on them and their expectations. We need to be examining the organizational culture about how do we attend to health, safety, and wellness for the workforce, and what do we do to make sure that we have healthy boundaries and we have healthy strategies in place for the workforce. We also need to look at comprehensive planning and evaluation around attending to things like emergency management, health, human resource, enhanced workforce capacity, supporting elders, having access to cultural and land-based healing and wellness, equitable compensation, and highlighting and learning best practices. Miigwech.
Thank you, Dr. Bastool and Dr. Hopkins. And again, their workshop will be available after our break. Our third panelist is here to discuss emergency management transformation. Mr. Stacy Dewar is from the Siksika First Nation in Alberta and has worked in First Nations in first response for 23 years in a variety of areas. He previously worked as a fire captain for the Siksika Nation for 17 years and a training officer for the same department, as well as working for the Alberta Emergency Management Agency First Nations Field Office for 4 years. He is currently the Director of Emergency Management of the Siksika Nation and here to talk to us about emergency management transformation. The floor is yours.
Good morning, everybody. I just want to say thank you very much for having me here today. Just listening now, we've got some great speakers. I don't have a PowerPoint per se for today. I just want to talk about, we've had some great presentations on everything that we need to look at when it comes to emergency management and the subject Build Back Better and what that means in our communities. The experience I can give is taking all of the what we discussed today and discuss what we need to do in an emergency management standpoint to put all of that knowledge in and start to developing a plan. And within that plan, we need to start looking at how we can support our community. And once we have that support and that plan together, then we can start strategizing and looking at how the government can help us and how we can get other agencies to advocate for us to start bringing a voice to the GOA and to our chief and council on how emergency management needs to be supported in all communities. Back in 2019, I did a resolution number 7 And in that was a support for a proposed First Nations Training Institute on emergency management. And what I was trying to advocate is for emergency management, we have, the Emergency Management Act here in Alberta, but there's nothing in there that has a specifics for First Nations. So whenever we have any kind of emergency management training and support the First Nations, always based on the province. So now my proposal was to talk about how a First Nations emergency management team can support other First Nations communities, and that's right across Canada. So what we do is we develop key areas where we have emergency management training facilities, where we can start talking about how we're going to respond to any event, to COVID, to any hazards related to those communities. And when we have them in key locations, then we can start looking at specifics for those communities. I know the other discussion that's when we talk in person is the Build Back Better programs that we have. So my perspective is how can we look at what is it going to look like for COVID after the funding is gone, after the supports from the GOA and COVID is normal. Build Back Better is how can we utilize the supports that we have now to build on the capacity that we have right now to support our community, so that we go into a COVID normal and start responding that way. So building on the structures that we have, building the capacity of getting the psychologists in here to help with our community, because that's going to be a huge impact for a boots on the ground person like myself, and making plans for a bunch of communities. That Build Back Better program is very important because we have to be prepared that when we start going back to the recovery piece, that we have the tools in place to transition from a response mode into a normal day-to-day operations, and that's at all levels. That's from the administration, that's from the community perspective, and also too from chief and council. So I'd like to talk about that when it comes to when we do the workshop. Also too is, and then build on also too is the framework. I know those questions came up, is framework and what we can do to develop emergency management within the communities, and also start bringing that to the higher levels into government and show the importance of a dedicated director of emergency management within all the First Nations. Now we talk about how we can improve our responding to any COVID, anything else, that is the key, is not a lot of communities have a dedicated director of emergency management like myself. So that's another issue that we have to address, is a lot of the times, a lot of the directors of emergency management are the public works guy, or wears two hats, and emergency management sits at the edge of the desk there. So within that resolution and the supports that I've always advocated is that every First Nation needs to have funding, permanent funding in there, that they have a dedicated director of emergency management. And what that'll do, the importance of that, and getting with everything and how we can support, the communities, is having a dedicated director of emergency management that can actually do a planning sessions at the chief and council level, at the administration level, and also into the community. What's happening now is in Canada right now is the Canada building resilience in your community. Along with making a plan and having a planning section with chief and council and the administration, is you develop that plan, and you, again, being with that Build Back Better, how we look like, and into that recovery piece. When you have a good planning session with chief and council and the admin, and how we can start going into the recovery mode, which means gathering up all of our information, start to do a separate report on lessons learned. And in order to do that, you need to have a focal person, which is the director of emergency management, to start implementing that idea. And when you do that, the director of emergency management ends up being that hub with all the experts. We talk about, I'm listening to all these presenters today, which are fabulous, is we start bringing in the doctors, the psychologists, and we start coming up with a plan on what that looks like. Once we have that framework, then we get into, hey, how can we make ourselves better as a community? So when it comes to, again, right now we have the fourth wave. How is that impacting First Nations? Well, in my community and in Alberta here, it's really affecting the First Nations. 420% increase in our First Nations contracting COVID-19. That's right across Alberta. That's a huge number. In the last few waves, we got a great team here, great health services, that were able to adapt, and we developed, and I was able to go to the government and do that Build Back Better program and start addressing what we discussed here too. Is the one thing we have housing shortages. We have some homes that don't have the capacity to isolate. So it's that concept that we need to now bring back and have that framework and bring everyone together for this fourth wave. There's been a lot of lessons learned right now, and that's the one thing that we have to do is we have to develop our own sense of plans and planning and utilize health services or Health Canada as a template, but develop our own way of how we're going to respond to COVID. Right now, we're all looking at the health services to guide us in what we're going to do, but it doesn't support the fact that we need to develop our own plans within our community, and it has to be specialized within that community. So there's a lot to discuss. I'm so excited to talk to everybody and get some feedback. My perspective on everything else is again, boots in the ground and the experience that I have, and I've always been passionate about passing that along to other nations. The other thing too is when we start looking at all the stuff that I've just discussed, is bringing all the nations together and start to develop a resource list, policies, procedures, and then we can start giving them up to, in support from the AFN, in support from the federal government in all the provincial areas. And when we come together as a one nation right across Canada, we have more voices, and we can have a consistent ask right across the board on how we can support emergency management. Because the concept, and one of the last things we'll discuss is the concept of emergency management is sometimes not clear in a lot of the nations. And what I mean by that is, what does emergency management do? How do we respond? There's different types of, there's emergencies where the fire department responds to, and there's emergency management that is the overseer of the major events and is a very good support system. So emergency management needs to be explained even to our chief and council, and what it can and how it can be responded to. In terms of COVID, the biggest discussions that we had here is, where does emergency management fit within this COVID response? And right away, everyone started going towards how health services need to respond to this COVID event, which is right. They are the people that are the experts to go and help the communities within for the medical purposes. But there's still an emergency management piece behind that can support health services. While health services are responding to the actual COVID cases, emergency management can now be that support piece. They start bringing in resources. They start bringing in experts and start planning ahead of the pandemic, and start developing, again, going back to the Build Back Better, is what are the challenges that health services is having, and how can emergency management help support them while they're responding to COVID? So that is really the key here that I'm really excited to talk to other nations about, and their challenges of how maybe they're not supported by emergency management, or they don't have a system there, and how they can now access funding and start doing what Siksika Nation has done and that's building a community-based disaster risk program. So you can go into your community and do a specific designed emergency management plan to your community, talking with the elders, the community itself, chief and council, even the administration. How do you address all of the hazards or events that always happen in your community and tailor it to that plan? And then when you have that framework and when you have that foundation, the last thing I'm going to talk about before we leave is, once we have everything that I talked about, is how do we apply for funding from Indigenous services here in Alberta and everything like that. We need to change the way we go for funding. And what I mean by that is tell the story to how we get funding, and start having a 5-year program with them in terms of funding to support your community. And it's all based on your community-based disaster program. And again, having all that will help us all for future pandemics, for the ongoing, COVID response that we're in right now. When you have that framework, and the other questions that kind of came up was, what are the training and capacity? See, here's where we need to build that and support. Again, I want to go back to specifically for emergency management, how you support a direct emergency management in your community is when you develop that person and you bring some experts in to train your direct emergency management, how to teach incident command systems, how to teach how to respond to all emergencies, and help support admin, chief, and council. Those are the training things that need to be brought into the community and supported. Because once you have the plan, you now have to develop resiliency, and you now have to develop your actual team. A few more minutes here, and when we do all the training and development, the last thing that I want to, I guess, whet everyone's appetite is a lot of nations don't have the capacity to have a emergency management team, and so we have to go to outside resources. So what we have to do is develop within our plan, how can the outside agencies, municipalities, how can they respond to our First Nation? Culturally teaching them what to look for when they come here, and not come in and just take over the event, but work with us. The last thing too is how can we work together as a nation and provincially, nationally? How can we work together? And here in Alberta, in southern Alberta, the Blackfoot Confederacy, start looking at developing in the treaties where you have a Treaty 7 based Confederacy emergency management response team. So every community you have a designated 10 individuals that are trained in EM. So what that does is it builds a huge capacity to a response. So if my team is responding to something and I'm getting tired, I can now call the other response team and they can come and relieve. We've got to start thinking about this, and this is the perspective that I want to bring is we gather all that information, and what are the things that we're missing here when it comes to our planning, when it comes to our training, the messaging we need to give out to our community, and also too is the resilience that we need to also create in our community. We have to show our community how they can respond and help us, because together as a community, on our ways as Indigenous people, we come together always in a community. All the clans come together, and we will support each other, and that's always been proven. It was proven in the 2013 floods. Siksika Nation responded very well, and that was all based on the community coming together and supporting each other, supporting the families. Thank you very much. I'm looking so forward to the workshop and hearing some feedback from everybody. And please bring all your questions. I'm here, and I'm ready to answer everything. Thank you so much.
Well, and Stacy, and those emergency management plans are some things that we usually push off. There's always something more important that we feel like, but when the day comes, we need them. And thank you for your talking. And I hope those people that go to your workshop can actually communicate with you and see what the importance of that. So thank you very much for your presentation. Our final panelist is here to discuss economic recovery. We have Ms. Tabitha Bull, President and CEO of the Canadian Council for Aboriginal Business. Tabitha is Anishinaabe Kwe from Nipissing First Nation And as CCAB's president and CEO, she's committed to help rebuild and strengthen the path towards reconciliation, as well as a prosperous Indigenous economy that will benefit all Canadians. Tabitha is a proud mom of 2 boys and can often be found in a hockey arena, at the baseball diamond, or on the lacrosse field. So to talk about economic recovery is Tabitha Bull.
Thank you, and it's a real pleasure to be here. I will give a little bit of a background on CCAB, who we are, and I know that we're really talking about COVID and health needs, but just how we see that Indigenous economic recovery can play a part in that. So next slide, please. So CCAB is a national nonpartisan membership association. We've been around for almost 40 years. We are a membership-based association with over 1,500 members, both Indigenous and non-Indigenous businesses, about 65% Indigenous business in every province and territory, every sector and every size, and 35% non-Indigenous businesses. So also every sector and size, from institutions to corporate Canada, across the country. Our mission is to promote, strengthen, and enhance a prosperous Indigenous economy. And we do that through fostering business relationships, Indigenous inclusion strategies in corporate Canada, opportunities and awareness for all of our members. I'll speak a little bit about some of our programs as well, and then some of the research that we do. Next slide, please. Just a bit of a background on where we are in the Indigenous economy. There are currently over 60,000 Indigenous businesses in Canada, according to the 2016 census. And we're seeing Indigenous businesses being created at 9 times the rate of non-Indigenous business. So significant growth. 2016, the census that came out in 2011, reported in 2016, noted 46,000 businesses. So we're seeing this incredible growth and resurgence in the Indigenous economy. We also know that Indigenous businesses are more likely to innovate than non-Indigenous businesses and have more propensity to export. So our research is so important and critical to the work that we do, but also helps to inform governments, corporate Canada, and a number of our programs. Currently, according to Statistics Canada and some work we've done with TD Bank, Indigenous population contributes 31 billion to Canada's GDP. And we believe that Indigenous business and Indigenous people have the ability and to contribute 100 billion to the GDP if supported properly. Of course, everyone here knows that Indigenous population is the fastest growing population in Canada. And we see that in the number of Indigenous entrepreneurs that are graduating from school and starting their own businesses rather than going to work downtown Toronto or in a city center. And in some ways, we've seen both the hardship from COVID impact on Indigenous businesses that are in their community, but also a bit of an advantage as we move to a more e-commerce platform. Next slide, please. Just a little bit about CCAB and what we do. As I said, all of our programming is backed by our research. We have about a third of our team specifically looks at research on the Indigenous economy, and specifically looking at procurement as one of our biggest priorities, as well as propensity to export, and quite a bit of work right now on future skills. So as we see automation to clean energy, as we see all of these new incredible graduates from post-secondary institutions, really helping to inform corporate Canada as to employment strategies for future Indigenous workers, but also for us to understand where there are gaps and how we can support institutions in preparing Indigenous youth for those jobs. Through that research, we've developed a number of different programs. I'll speak a little bit more detail about a couple of them quickly, but one area that we are doing a lot of work is networking. So building tools and capacity for Indigenous entrepreneurs to have free access to, but also connecting them with potential buyers, with potential mentors, so that we can make those partnerships from a small Indigenous business to be able to get into the supply chain of corporate Canada or government, but also to be able to start to enable those partnerships. We also have events and awards to really ensure we're celebrating Indigenous leaders across the country. And of late, we've been doing quite a bit of work on public policy. So I'll be talking to that a little bit. As we saw COVID programs, recovery programs roll out, a number of the programs were not accessible to Indigenous businesses, specifically some to First Nation on reserve businesses. So we had a lot of work to do with government to see those programs change. Next slide, please. One program I just want to talk quickly about is our PAR program. This is a certification program where we work with Corporate Canada to look at their corporate performance in relation to how they're working with Indigenous people, businesses, communities. And that looks across the entire organization at employment, and not just how many Indigenous people you're employing, but where is the opportunity for those Indigenous people to move up within the organization? What's your retention of Indigenous people? Business development, which specifically looks at procurement from Indigenous business, but also looks towards partnerships, equity partnerships with Indigenous communities. Leadership actions, so that's really where we see organizations incenting their supply chain to do better with Indigenous people and businesses. And then community relations. And we definitely saw through COVID support of some Corporate Canada, specifically of communities in supplying PPE to communities, and also working with communities if they were going into a community to do work and being respectful about COVID testing, about supporting the community and understanding the community's needs around businesses and opening borders. Next slide, please. So just to talk a little bit about, why we feel that this is important. These stats are a little bit old, but just to look at the impact that procurement and business development and growing the Indigenous economy can really have on the social economic gaps that exist across Canada. So if we look specifically just at the oil sands region, and we're looking at organizations like Suncor and Imperial Oil, in 2020, Suncor has had a commitment to purchase 5% of their supply chain from Indigenous business. They are almost at 10%, and that equates to $911 million per year that they're spending with Indigenous-owned businesses and community-owned businesses. And we really see that in both employment rates within Fort McKay First Nation and other First Nations in the area, but also on per capita income of employees and residents. So as I said, this chart's really based on 2016 data, where the amount of spend was closer to 500 million. And we've seen some incredible equity partnerships happening since then. But it gives us a glimpse as to why this work is important, why procurement from Indigenous business and supporting Indigenous business is important to support community and community members, and to really build the entrepreneurship strategy and opportunities for our youth. Next slide, please. So I'll just quickly talk about supply chain, which is a program that we have specifically for corporate procurement. We have 1,000 certified Indigenous businesses that are part of this marketplace, and over 100 procurement champions, who are organizations who are committed to purchasing from Indigenous business. And I'll skip over this part and happy to answer any specific questions in the workshop. So next slide, please. And we'll go to the next slide as well. Thank you. So just a little bit about research, and really pleased to listen to Dr. Jawar's presentation as well. We are committed to ensuring that all research that happens on the economy has a perspective from Indigenous business. It's been too long that we haven't seen Indigenous economy been discussed or really understood by the government internationally as well. And we are really focusing as well on doing on all of our research, both gender-based analysis and distinction-based analysis. So I'll speak a bit about some of the findings from our most recent survey. Next slide, please. So at the outset of the pandemic, we wanted to really understand what the impact specifically on Indigenous business was of COVID-19. We've undertaken 3 surveys now, and all surveys have had over 800 businesses respond. One was at the outset of the pandemic. One we undertook December to February, and we've just completed another one, which we're finalizing the data. Next slide, please. So just to give an idea of the respondents that we had, so 64% of the respondents were first identified as First Nation, and we saw a 40% being within the community and 53% in urban centers. Next slide, please. So overall, in the first survey, we saw that 91% of businesses were reporting a negative impact on their business, either very or negative or somewhat negative. We saw some increase or improvement on that, up to 73%. Of those, 57% of businesses remained open, and almost 4 in 10 had to close temporarily over the course of the first year of the pandemic. So these numbers do appear to be improving. However, we need to keep in mind that if you are a business that has already closed, or we're struggling just trying to keep the lights on, we don't expect that those businesses would have been as highly represented in the survey. So to keep that in mind. Next slide, please. So top 5 impacts, definitely decrease in revenues, but I want to kind of highlight here, we are seeing 41% of survey respondents who noted a higher anxiety in their staff. And additionally, not noted on this slide, but 36% of businesses said that they were impacted by closed or restricted travel in and out of their community, and 27% had to lay off staff. A number of businesses also noted staff absence, and I just want to highlight some things which I think are most relevant to the audience. 20% of those were due to quarantine, self-quarantine, and 18% were due to family responsibility. And we saw this across the board, even in our conversations as well. In the Indigenous business community, 99% are small and medium enterprise, so smaller businesses with 1 to 4 employees. So staff absence can have quite an impact. Next slide, please. This was an important thing to note. As I said, there were a number of barriers within the programming that ended up delaying the assistance of recovery programming to Indigenous business. So really key for us to be able to demonstrate that delay in programming has a direct impact on Indigenous business survival. We did see some improvement, as you can see, in the second phase as programming started to roll out, and Indigenous businesses were able to apply. Next slide, please. When we look across Indigenous businesses, 72% said that there was a need for financial assistance, but we only saw 58% of those businesses apply to government supports. Businesses noted that there were barriers with respect to financial requirements and application requirements. Financial requirements come up as a number of businesses do not have an existing lending relationship with a major bank. And we definitely saw this higher in the First Nation respondents than in Métis respondents. First Nation businesses noted that they face greater barriers in accessing financial support. And next slide, please. We did see a number of businesses that were able to provide PPE. So at the outset of COVID, there was a call, as you all recall, I'm sure, of Canadian businesses to be able to supply PPE to government. At that time, about 12% of the respondents of the survey were already providing PPE in some form. But then we saw another 8% who were able to pivot to create PPE. So those were some distilleries that were able to start to make hand sanitizer. We saw a number of businesses that came on board, particularly in non-surgical masks. And a real indication of this is the federal government launched a Indigenous-only RFP for non-surgical masks. 233 businesses across Canada, Indigenous businesses, bid on that proposal. So there is a real opportunity for Government of Canada and Corporate Canada to support Indigenous business as we continue to move through this recovery period. And we did see some success there with BMO, Hydro One as examples, and Petro-Canada purchasing their PPE from Indigenous business. Interestingly, and maybe not surprisingly, and just something I want to note is we also found that 34% of the respondents developed or introduced an initiative that would support their community members, or other businesses. So I'm sure not a surprise to this audience, but something we want to always highlight is that even though these businesses were struggling, they still found ways to use their business and their business model to support their community and other communities. And that's something we continue to be loud about in when we have the opportunity. Next slide, please. So as we look forward at pressing needs and talk about Build Back Better, we definitely know, most businesses really are just wanting return back to normal. And as we see provinces, Alberta and BC, go back into restriction, that's definitely having an impact as we continue to move through this uncertainty. So continuing to push for government supports to continue and to ensure that their work for Indigenous business. Financial support is still a concern, but more a need for grants to be able to reduce debt that's incurring. And then support with management planning and staff. So you will see that this type of support, so including support for employee health and mental health, did increase between phase 1 and phase 2. And I think as the pandemic continues, we're going to see an increase in that. Next slide, please. So just a few things that we're looking for as we go to Build Back Better and with the current government newly elected, but as was spoken before, we expect that the mandates will be the same. So one is a federal Indigenous entrepreneurship strategy, and that's an ask that every organization and every ministry across government has a responsibility to support Indigenous business. Too often we see that Indigenous businesses are funneled to Indigenous Services Canada, and we firmly believe that every organization has a role to play. Government procurement, you will have seen perhaps August 6th, there was an announcement for every organization to buy at least 5% of their supply from Indigenous business. And we believe that this can have the greatest impact on Indigenous economy. Indigenous impact analysis, similar to the gender-based analysis that occurs with every new program or bill that's developed at the federal government, we're asking for the federal government to do a similar impact analysis on how it impacts Indigenous people, communities, and businesses. And hard set-asides of 5% of program dollars. So we saw over the course of the pandemic, and not just pandemic programming, but other programming, if it wasn't within Indigenous Services Canada, we didn't see a number of Indigenous businesses being able to access innovation funding, entrepreneurship funding. So we're pushing for a 5% carve out in that programming. Next slide, please. And then I'll just quickly wrap up on our further commitments, and happy to chat in the workshop. I'm really looking forward to answering any questions about the work we're doing or how we can continue to support entrepreneurs in your communities and connect you with those businesses who may be able to support as well. Miigwech.
Thank you, Ms. Bull, for that presentation. So we will be heading off to break in the next few moments. Just want to take a few minutes to inform people that also to honor the sharing of knowledge, a donation will be made in the name of each of our presenters to the Orange Shirt Society, as has happened with our recent presenters too. And just a little quick heads up and reminder on how you can get to your workshops. So within your the window of the presentations and what you've been watching, in the bottom you have access to 4 workshop buttons. If ever you are on the phone line, you should have received an email a few days ago from AFN Updates, which gives you a phone line to call in, and then also gives you the different meeting IDs, depending on the workshop that you want. So those are the 2 ways to access the workshops. Our 4 workshops will be from the presentations we just received on our panel. So workshop 1 will be the role of data governance with Jonathan Dewar. Workshop 2, Mental Wellness Culture Health Foundation with Dr. Carol Hopkins and Dr. Brenda Ristool. Workshop 3, Emergency Management Transformation with Mr. Stacy Dewar. And Workshop 4, Economic Recovery with Ms. Tabitha Bull. Just to remind you that our workshops will begin at 1 p.m. So in about 18 minutes from now, Eastern Time, and will last about till 2:15, at which point we will come back and the note takers from the AFN staff will give us an update to make sure that we can at least hear what was said in each meeting, just as we did on day 2. So for now, I will announce a break and we will reconvene at 1 p.m. within our workshops. Thank you very much. Have a great break. Welcome back, everyone. I hope those workshops were fulfilling, and so as much as the breaks were. To continue with our day, we will have report backs from the different AFN staffs and different workshops like we did in day 2, just to make sure that we can share as much information with all of you who are participating, watching, following, and being here with us today. So our first report back from workshop number 1, which was the role of data governance, is Vivian O'Donnell, AFN Special Advisor in Strategic Policy Integration. So Vivian?
Thanks, Cedric. We had a really fantastic discussion in our workshop, very dynamic and engaging discussion. We were really lucky to have participants from across Canada with a bunch of different backgrounds and experiences to share. So we
You can keep going, Vivian.
Sorry, am I on?
Yeah, you're on, you're on.
I can hear your introduction. I'm not sure why.
You must have the stream still open on your browser.
Oh,
Probably if
geez.
there's a delay.
Okay, I'm so sorry, everyone. I was scared I was going to have technical difficulties.
Floor is yours.
Okay, sorry, I have to close my other browser. I am so sorry.
The same thing was happening for me, and I didn't know if it was my fault or not. I've got mine closed as well.
Okay, I'm glad I went first. Okay, as I was saying, we had a great discussion on data. We were with Dr. Jonathan Dewar talking about First Nation statistics and COVID data. We talked a lot about the challenges that First Nations face in securing high quality, timely information. A lot about jurisdictional challenges because we want the information to get to the decision makers at the First Nations level, but they have to deal with multiple jurisdictions, you know, the provinces, Indigenous Services Canada, and so on. So we also talked about the solutions to those challenges. And there were some examples given of successful partnerships, including having data sharing agreements in place to make sure that that data is flowing easily and conveniently to the decision makers in the First Nations. It was stressed that the solutions are not to be, it's a pan-Canadian approach will not work. It has to be at the regional level. And it was also stressed that relationships are most important in putting those agreements in place. And those relationships cannot be built overnight. They need to be constantly built. And that the First Nations and regions that had the most success in securing high quality COVID data, timely data that they could rely on to make decisions were those regions that had pre-existing data sharing agreements in place. So again, really stressing the importance of those relationships. And Jonathan, you know, he reflected that in his presentation about how the First Nations data governance strategy is about that, about building those relationships, maintaining those relationships, and having the data champions in place in the regions. Another theme that kept coming up was capacity building, building capacity within the First Nations so that our leaders understand what to ask for and then know how to interpret what they get back. A barrier that was talked about was mistrust around data, about not being willing to share data. And so again, why we need to continue to build those relationships. There were some very practical examples given of real life implications of having the data and having those data sharing agreements in place. The example, for example, the example that was given was Manitoba. So because they had data for on and off reserve, they were able to assess that First Nations were at a higher and earlier risk of severe disease from COVID. And this gave them the evidence to argue that they could not delay the second dose, that it needed to come 28 days afterwards. This is, a real life implication of having the data and having the evidence and having those relationships in place, and the power of data. I think that's it. It was, as I mentioned, it was a fantastic discussion, and I would just say that a lot of the challenges that were raised and the solutions that were raised were captured in the First Nations data governance strategy that Jonathan had outlined, about having those regional champions in place, building those relationships, building those data sharing agreements, building capacity in First Nations in order to enter into those agreements and to use the data in a useful way for making good evidence-based decisions. So thank you to everyone who participated. It was fantastic.
Well, and Vivian, for our report back from workshop number 2, Mental Wellness Culture as a Foundation, we have Travis Kirkwood, Senior Policy Analyst in Health from the AFN. Travis?
Hi, thank you, Cedric. I wanted to say hi by camera. It's a little embarrassing. It's just my name there, but it keeps freezing. I'll see if I can. Oh, that doesn't look too good. But anyhow, yeah, I'll turn that off for now. Yeah, in our conversation, we had quite the privilege of having a very organic discussion with Drs. Ristool and Drs. Hopkins. And, I certainly can't do it justice, some of the things that we talked about in 5 minutes. And it reminds me that there are, and especially ever since the beginning of this pandemic, there are some incredible resources that have been developed by these two individuals and their organizations at the Thunderbird Partnership Foundation and the First Peoples Wellness Circle. And if anything caught your attention during today's discussions, I'd really recommend at least beginning having a look at their websites, because there's so much there. And yeah, these two people are rock stars. So I couldn't imagine how I can summarize all that was shared. But one thing is that there were a few slides that they didn't get to during the plenary conversation. And those are important because they're key takeaways and recommendations from some of the things that were discussed and that have been discovered. And they're quite important for effective governance and service delivery and cultural safety and such. And some of these are just the critical importance of land connectedness for healing. And again, that transcends just the two specific areas that were mentioned, which were substance and the workforce and supports for the mental wellness workforce. So there was land connectedness, just generally land-based healing, practice, and ceremony. And this applied also to life promotion work. So life promotion, suicide prevention, and then also the substance use treatments and support. There's always a fundamental importance of trauma-informed approaches. And we did have a little bit of a deeper discussion about, in some cases, maybe there's a need for increased specialization for the workforce that is providing trauma-informed care. We've heard of certain workforce members, such as the Resolution Health Support Workers for the Indian Residential School Supports, that program. In many cases, they're helping individuals with things not just Indian residential school experiences, but maybe it's MMI, WG, or day schools, or the very heart-wrenching more recent news regarding unmarked graves. And so a big theme of our conversation was really the need to support the workforce. And actually, as a nice wrap up to our very thorough discussion, Dr. Hopkins said that in a sense, building back better, for First Nations, one thing that does mean, among many other things, is fully and adequately supporting the workforce. And so, yeah, that was another one of the main themes. Like I said, what is building back better? Because we know governments have been using that. And another thing that was pointed out was that I have way too many notes here. The pandemic, it has been a lesson more in what we have done better And really it's in many cases it's just given evidence of what should be funded going forward. And so, whether it's in youth, in the mental wellness workforce, COVID-19, it's uncovered strengths and solutions and innovations. And so, building back better, one thing that might mean is it's government's responsibility to address the gaps and the needs, but also the solutions that were identified through these times. I'd like to highlight a few more quick things, just trying to be succinct here, but just so much great wisdom that was shared. A big idea, again, in supporting the workforce, there's the issue of pay equity that was mentioned during the plenary, and providing adequate benefits for the workforce. But then there's also the need for infrastructure. So, for example, just where this workforce is being housed, the actual facilities, and then kind of the minor or the soft infrastructure in many cases, as the workforce moved out of the office and into the community. Not all of them had laptops and simply could not work from home. And then another very important topic is the idea of vicarious trauma and some of the supports that this workforce has been providing. And that, if there's no opportunity for debrief and adequate supports for that workforce, Dr. Ristol said that in some cases, vicarious trauma can become its own PTSD effectively, and that it really is critical to make sure there's systems in place so that care providers, there's an opportunity to debrief for the workers and get feedback on some of perhaps the very difficult advice that they've just provided. And so I'll stop there. There's just so much great stuff, and I really thank you all for your time and attending.
Well, and Travis, for our report back from workshop number 3, Emergency Management Transformation, we have David Daibo, Special Advisor for Emergency Management at the AFN. David.
Thank you, Cedric. So we had a good conversation in our session presented by Stacy Dorr from Siksika First Nation Emergency Services and Security. And we touched back on the Build Back Better, in that it actually touches every aspect of First Nations recovery from COVID-19. For example, lack of adequate housing, overcrowding housing, isolation issues, quarantine, addiction, and psychosocial issues, and the need for an EM program inclusive of COVID-19 situation-specific programs and plans, and recognize that there should be a definition of hazards due to COVID-19 and the identification and addressing of these hazards and their cascading issues. Touched on water and food security and shortage, and the need for a program and planning to operate on 2 levels. High-level authority for overseeing the big picture for community and situation management, and the ground-level authority overseeing operations and implementation with adequate resources and personnel capacity and equipment. Identifying proper personnel to participate in this planning group. So with leadership authority through chief and council, finances, and other departments, and with operational experience from police, fire, and emergency medical technicians, as well as public works, for example, and that both levels must have open and reciprocal communication for smoother operations, given that there's usually a breakdown when it comes to the communications part, because there's so many actors involved in the provision of emergency services for First Nations. You'll have the community level, you'll have maybe regional, provincial, and then federal, and there's always a question of who's doing what and who's responsible for what and who's paying for what. So things get kind of muddied and kind of murky, and sometimes they break down. And at other times, the First Nations are removed from the actual responsibility for the monitoring and taking care of the developing emergency event, and that's kind of taking them out of the situation, because the response might not be culturally appropriate. So there's a bit of a breakdown there too, that they must be involved at all times, and there's a need to build in adequate and appropriate support through engagement with provincial or federal agencies during events due to those reasons. And there has to be some collaboration happening there, and it has to be operative, and it has to be ongoing with all required components. that kind of service. And there was also a recognition that this group must be able to represent First Nations in any negotiations for the provision of emergency services for First Nations in future emergency events. So this is taking a look at the long range for the future of First Nations in that region, which is Alberta, where Stacey's from, and that while they do have a signed agreement with the federal government known as the gold standard, but it's a bilateral agreement where now going forward they're trilateral agreements, and that that agreement, when it does come up for renewal, must have First Nations seated at the table, contributing their voice and their perspective as the end users of the emergency services being negotiated. So that's a big thing, and there was a bit of discussion around that, and that led to discussion that there was a need for a national level group cooperating, collaborating and overseeing First Nations emergency management and the development of awareness and education materials and hazard-specific documentation, recognizing that every region is different, every region has different hazards, every community has different hazards. This would be a very comprehensive project to get off the ground, but I imagine it's going to be in the works somewhere. I know at AFN we're doing a little bit of that. So the conversation was good and centered around the responses through Stacey and his team in Alberta and how they manage that, and how they're being First Nations but working for a provincial organization. It's not always easy for them, but they are there for First Nations and offer to help whenever and however they can. So I'll leave it at that. Thank you, Cedric. Thank you, everyone.
Well, and David Divo. And finally, for our fourth report back on workshop number 4, Economic Recovery, we have Will David, Director of Economic Development at the AFN.
Thank you. Thanks a lot. In the economic recovery session, we had a very, very rich discussion. And I'd really like to thank Tabitha Bull for being there and driving that rich discussion. It was very, very evidence-based, so it was really remarkable because almost everything that we talked about was founded in not only some of the research that the CCAB has done, but also a lot of the insights that come out of that research and in the analysis. So again, very much appreciate her participation and her insights in the session. Went through 6 or 7 bigger points, and you'll have to forgive me for not necessarily doing them justice and taking them potentially out of order. Having said that, we started with a discussion on the existing supports and challenges that First Nations businesses may have had around accessibility. So for example, with the emergency business account, one of the barriers that we identified is that participants must have a CRA account number. As an example of something that looks like a fairly neutral program criteria for access that a lot of First Nations businesses don't necessarily have, because unreserved businesses don't always need one. We also learned that Ontario actually reformed its program to accommodate that particular gap within the program criteria. We also noted that just in general, federal supports in particular, to the extent that they rely on loans and provision of loan funding, have resulted in an over-reliance on loans by some First Nations businesses, which leads to an accumulation of debt. Just going forward, it's really helpful the extent to which we can actually have programming which is a little bit more focused on grants, really to reduce the debt burden that First Nations businesses are taking on as a result of the recovery. And finally, we found, and didn't really have very much of a conclusion on this, although we did have some speculation that First Nations businesses don't seem to participate as much in the wage subsidy as others. And that could be any number of reasons behind it. And we're looking forward to more work out of the CCAB to really get into the wage subsidy and provide some idea of what's going on there in terms of the barriers. Again, very relieving in the sense that we know what the barriers are. A bit challenging because it's, again, moving the federal government to adjust the challenge. We discussed at length the idea of an Indigenous impact analysis, not that dissimilar from the GBA plus analysis to deal with some of these issues before they actually become problems. Discussed about how something like that might happen and really the benefits that come to it. Not only for First Nations businesses, but frankly for others as well, just in terms of doing that kind of a scan to ensure that federal government doesn't inadvertently discriminate against First Nations businesses or others when crafting any number of programming, COVID recovery programming, but then others. We learned about one fund, Strategic Innovation Fund, which granted out $93 million. None of it went to First Nations businesses, despite the fact that First Nations businesses demonstrate a large amount of innovation. We did discuss specific sectors that have been potentially impacted by the pandemic. So for instance, tourism, which had seen explosive growth prior to the pandemic, was naturally impacted quite heavily, as well as some of the measures that First Nations are taking to try to pivot their model there. Similarly, with e-commerce, we learned that, again, some First Nations businesses managed to pivot to e-commerce, but have experienced barriers around broadband and connectivity, around online marketing and the need for online marketing and more sophisticated online marketing, and even challenges related to the supply chain, something as simple as getting their hands on packing materials. Similarly, we found that the private sector is actually stepping up in many cases. We heard about specific initiatives from specific companies to basically enhance broadband access, as well as from delivery agents and companies to actually support better e-commerce chains, particularly in rural areas. We also noted that the goodwill that's been generated between the private sector and First Nations businesses is pretty real and profound. And indeed that we should be celebrating these and building resilience going forward to ensure that both First Nations business and the broader economy can prosper together. Thank you.
Thank you, William David. And I just want to take a final moment to thank the four staff that were here to support us in the work that was done in bringing back all this knowledge, all this information to our viewers, and thank again our viewers for being here. I also want to take the time to thank Dr. Jonathan Dewar, Dr. Carol Hopkins, and Dr. Brenda Restool, Mr. Stacy Dewar from Ccab First Nation, as well as Ms. Tabitha Bull for all of their sharing and all of the knowledge that they gave to us today. Again, what the point of this forum was to come together, share our information, and hope that we can build better and build back a future that is First Nations oriented. And finally, before we get towards our closing statements and our closing prayer to end this forum, I'd like to turn it over to National Chief Roseanne Archibald, who sent in a video to provide her closing address as National Chief. If a National Chief, Roseanne Archibald is from Tagwa Tagamu Nation. She's a third-generation chief in her family, whose leadership has been really groundbreaking and historical for women and also for youth. In 2018, she became the first woman Ontario Regional Chief, leading the Chiefs of Ontario, and in July 2021 was elected as National Chief of the Assembly of First Nation. So if we can have National Chief Archibald's closing statements. We're having a few issues with National Chief Archibald's video. Maybe something got corrupted in the upload. Our staff will take a few minutes to try to figure it out, see what we can do with that. I just want to take a bit of time then to thank the people that were here, the support staff that organized this event at the AFN, but also our French, English, and American Sign Language translators. We talk about accessibility. We talk about trying to adapt our ways to be open for everyone, as we saw in yesterday, day two's presentations. So just take a moment to thank you all for your work. This is a big forum. It's still virtual, so we understand that there are certain difficulties that we have to face sometimes. But again, we got through it and hoping that we can offer to our viewers, to our participants, to everyone who's here listening and following, quite a bit of an experience that is interesting and also one that is helpful for you guys in your own communities, your own nations, your own regions, and obviously your own organizations. I'm going to look towards our staff to see how that's going. And if not, we can get through a few of the reminders too. Also, we understand that talking about something as big and as stressful as COVID-19 has been might elicit certain emotional responses. So again, just to remind you that throughout these discussions, and always available for you guys, is the Hope for Wellness line. We have it available at 1-855-242-3310, and also at hopeforwellness.ca, where you can chat online. So again, the resources are there if ever you need them. I'm getting a message that we should be good for National Chief Archibald's video. So let's have a go.
Wachiamasli, Okamakanik, Okamakanishik, Geshehog, Esquoak, Nishta, Oshkanigawak, Roseanne Archibald, Natishnagasan, Dagwadagmo, Ishnakatakoachian. First, I would like to acknowledge the Creator, the world around us, and our place within it. Today, I'm coming to you from the traditional territories of the Lekwungen, Malahat, Pasichat, Sianu, Suk, and Wasanich peoples. And I acknowledge all of you on your home territories. Miigwech Cedric Gray Lahu, Forum Chair, and Knowledge Keeper for your presence here. I also want to recognize Regional Chief Marlene Poitras as the co-chair of the AFN COVID-19 National Task Force. I want to thank everyone for virtually attending this important forum, from our frontline workers, the organizers and presenters, elders, leadership, parents, community members, and our youth. We are grateful for the role each of you have played in this forum and over the past year and a half. These 3 days of the forum have shown us the pandemic responses through a diversity of experiences and viewpoints. On the first day of the forum, we saw the importance of culture in responding to the needs of our nations during the pandemic and the value of relationships and working in partnership. On the second day, we talked about innovative responses to address the social impacts of the pandemic, including organizations' responses to supporting the needs of youth and mental wellness of youth, First Nations struggling with homelessness and housing needs. And today, we looked at how we can move forward together to support First Nations data sovereignty and the opportunities available for First Nations businesses and how we can leverage our strengths. We learned about transformative visions for emergency management so that we are better prepared to protect our nations in the future. And finally, we heard about how we can support the mental wellness of our nations through First Nations-led solutions grounded in our culture. The learning from the pandemic and the inequities it exposed highlight that First Nations rights have been systemically undervalued and ignored for generations. The opportunity now rests with the federal, provincial, and territorial governments to commit to acts of reconciliation and truth through collective action that support First Nations rights to self-determination that embraces a healing path forward. The healing path forward requires changes to the fundamental elements that support First Nations rights. I have promised to work with all regions to build a post-pandemic recovery plan for First Nations. It will detail the necessary support for First Nations, inherent and treaty rights, and nations and regions in developing post-pandemic recovery plans in the areas of health, economic, and social. This includes fully engaging women, youth, and two-spirited LGBTQIA+ peoples in these conversations. The AFN will continue to advocate for First Nations rights, including the right to a just and fair recovery that pushes for a healing path forward and improves the relationship between First Nations and Canada. The pandemic has emphasized the strengths of nations, regions, and the critical role they play in protecting and supporting First Nations. I support the regions to conduct work on the National Action Plan as they see fit. Recovery and striving forward will be a journey within itself, but we are not alone. We must take up our medicine and ceremonies, spend time with our family and friends, and learn from our teachings and our elders. Leveraging the strengths in our culture, collective experiences, and restoring the balance within ourselves and our nations is key to the healing path forward. There's much we can learn from each other, and together we can prepare to be even stronger for the future. As National Chief, I look forward to the next stage with hope and optimism. Miigwech for all your work in keeping our communities and families safe. There is a healing path forward, and we will get there by working together. Ninanaskamun Gisakitin. Ninanaskamun in my dialect means I am grateful, I am thankful, I thank you, and Gisakitin means I love you.
Lala National Chief, for your words and that inspiring speech. Before we go to closing our meeting with our knowledge keeper, I'd just like to reflect on a few of the things that I heard during this meeting. The first one, the importance of supporting one another and adapting our methods to the needs of the people who we're working with and including them in the decision-making process. The importance of data governance. All 3 days, data came up as one of the most important parts. Knowing where we're going and knowing where we come from is part of the solution. The importance of preparedness. No one expected something like this to happen, and we've been in this for over 1.5 years. But we can prepare for the next ones. We can prepare for other things that might happen. And again, taking the time to do it isn't always easy, but it's something that has to be done. I also enjoyed hearing about combining traditional and Western approaches, combining our on-the-land cultural programs, but also combining them to Zoom and Teams and Facebook and all that, how we could come together and really go forward, making sure that we keep those links together. And talking about links, one of the most important ones is that everything be community-based. It is our ancestral ways, our teachings tell us that. Together we are stronger, together we will get farther. And before I pass it on to our knowledge keeper, I'd just like to highlight one of the quotes that we heard today, and that's do not fear the virus, but rather respect it. And if that's one thing that could be taken away from this meeting, we have to respect the virus, but we can't let it control us. Together, working as a community, we can make sure for the wellness of our elders, for the wellness of our youth, for the wellness of our men and women, and two-spirit brothers and sisters, that we can come together and go forward and again, build back better. So now, to close off our COVID-19 virtual forum, I'd like to give the microphone to Knowledge Keeper, Ernie Daniels. Knowledge Keeper, if you can unmute yourself. Thank you very much.
Hello.
Yes, Knowledge Keeper, we can hear you.
Okay.
All good.
Okay, thank you. Thank you, staff, for AFN that organized this event. My name is Ernie Daniels. I work with the Manitoba Regional Chief, Cindy Woodhouse. She also says hello to people today for the AFN COVID Forum. She's on the road right now as her role as a regional chief, visiting our communities that have health challenges. And so she asked me to come and speak here this morning as well, as to meet the request of Caroline and other people that have organized this event. By the way, Caroline, National Chief owes me 2 packages of tobacco now. This is the second tobacco that she promised me, so I need tobacco eventually down the line. And I wish to acknowledge the people from Ottawa area, the Algonquin people, the Mohawks, and the Crees of Quebec. I understand this event is taking place from Ottawa. So I wish to acknowledge them. And while I acknowledge the knowledge keeper, whoever started this meeting. I know I'm closing it, but imagine there was an elder that did the opening prayer. So I'd like to thank whoever that is. And I'm going to say a few words in my language. You had a long, fruitful, fruitful meeting last 2 days. So I'll be brief in what I have to say. I got a phone call yesterday from a community-based frontline worker, health, nurse. She was telling me she needed to talk to somebody, so she called me. She wanted to talk to me with some of the frustrations. She's overwhelmed, or tired, or exhausted of the work that you have to do. Regular work, then on top, COVID came along, and she's expressing her feelings towards me. And I said, I'll be talking to the AFN forum on COVID, so I'll tell your story of what you're going through, the stress and challenges of being a nurse with this COVID. And so I'd like to say that to her, that I am speaking on her behalf. And 41 years later, I'm sitting here as a knowledge keeper. 41 years ago, I was the first regional chief for Alberta, Saskatchewan, Manitoba. Back in 1980-81, one of my portfolios was health and education, social, housing. But the primary one was health. And some of the things I've heard last couple of days are the same things we talked about at that time. We have a long ways to go in terms of reconciliation. And I can't express enough how much my desire is to the leadership of this country to impress upon the government of Canada to provide more resources for our frontline workers on health in dealing with these challenges, as well as in mental well-being, wellness of our people, that more resources be placed, as well as capacity building, just to train more doctors, more nurses, healthcare workers, home care workers to assist our people. So I'd like to express that my desire to the leadership of this country, and I will continue to impress upon them to do that. So with that, me question the kid. Well, say I'm going to Gani mshkibish kin because of quando them go not skema don't say. Well, no, say I'm going to me go no na at the bending madzin. Ninakuma, Nugizuma, Usenima. Jimmy Jard no John Schreiben, was it the one I'm annoying? Quick, to the most any John Schnabe. Quick, his own is it any John Schnabe? Quick, Jimmy and John Schnabe again. Usenima. Way, you just got you must say ducky on again. Germany does in cause again. Nakuma, Nugizuma. I was saying again, Jimmy Jordan Josh Schnaben. Jimmy and I had mountain on, I just the modern the John Schnabe, Minayan. Through Conley again, oh, you mean you always yug. Jimmy Jordan, the John Schnabe. Oh, me top and all, say I'm on all of them. In Nakumag, Nugizumag, I was saying mag, you know, Jimmy John Schnabe. Well, I just said, well, on the Josh, Bob must said no, COVID gashing card again. Me, John Schnabe, no, but staying me go. Me with me could one. Thank you very much. Thank you. Have a good day. May God bless you, all of you. Bye.
Well, knowledge keeper, Ernie Daniels. And so that brings us to our end. I want to take a moment to say walalia to everyone who participated, presented, was in the background helping us. This is the closing of our COVID-19 virtual forum. Remember to wash your hands, wear your mask, and listen to your experts. Walalia, everybody. Have a great day.